Hello, my name is Dr. Chris Coker, and this is ChristianWebMD. The topic at hand is the mental aspect of disease, and this is the second topic on it. In the last section, we briefly mentioned that so many times the physical aspect of disease is actually influenced or caused by our mental state. Patients often ask me, what can be done about this? And oftentimes the patients will say that they seem to be a slave to their thoughts. Here's one trick that I often tell people to do. It basically is based on the theory of mindfulness, that we need to be aware of what we're thinking instead of just having automatic thoughts that run our lives. When a patient finds themselves constantly thinking the same negative thought, whether it's anxiety-provoking or causing depression, I will tell them that what you need to do is simply yell the word stop in your mind and then simply focus on something that you've decided to think about that is pleasing. Now, people often say, well, doctor, I'd have to do that 100 times a day. And actually that pleasing thought's just going to help me for a second. And I tell them that actually they're absolutely correct. The point of it is not to make you feel good. The point of it is to start to train your brain. What happens after a few days, if you can do this many, many times over the first few days, you actually start to realize what you're doing and you're starting to train your brain. It's not going to solve all your problems, but it's the first step in understanding that the way you think can be changed, can be modified, and can be, to a certain aspect, controlled. Remember, this video is for educational purposes only and is not meant to diagnose or treat any disease. Please talk to your physician about mindfulness and how we can begin to train our brains. If you have any questions about the diagnosis and treatment of anxiety, depression, or any other related disorder, please talk to your physician. And thank you for watching Christian Web.